Hello, good morning, everyone. I'm Stella Roque, Director of Community Engagement at the International Center for Journalists in Washington, D.C. Today, we continue our Lessons Learned Reporting on a Pandemic webinar series with a focus on Brazil. This webinar is part of a continuing series with the ICFJ Global Health Crisis Reporting Forum, which you can find more information on www.icfj.org. A reminder, if you have questions during this discussion, please post them to the Zoom chat and I will take them partway through. And if you're watching this on Facebook Live, please add your questions on the comments section to the Facebook live stream. And Teddy, one of the forum moderators, will bring them to the Zoom chat so I can take a look at them. So joining us today from Brazil is Patricia Campos Melo, an award-winning journalist with Folha de São Paulo, and just yesterday, she was honored by Columbia University with the 2020 Maria Moores Cabot Prize, honoring career excellence in coverage of the Western Hemisphere that furthers inter-American understanding. Wow, that sounds like a really, really big prize. Congratulations, Patricia. And in 2018, her coverage of allegations that a group of President Jair Bolsonaro's supporters were funding a bulk messaging campaign on WhatsApp prompted a slew of threats and attacks against her. She has served as a correspondent in the Middle East and Africa, and she's actually covered the Ebola epidemic in Sierra Leone and the Zika outbreak in Brazil. That's quite a bit of experience, and we're so happy to have you here today.
Thank you. I'm so happy for the invitation. Thank you for having me.
Thank you. So to begin our discussion, as we have an international audience on this webinar today, not everyone may be familiar with what's happening in Brazil during this pandemic, although from global reporting, we do know quite a bit about President Jair Bolsonaro. If I were a new foreign correspondent in Brazil, how would you explain some of the challenges facing the country during the pandemic?
Wow, Stella, that's a difficult question, but very good one. Basically, we are now the second country, we have the second highest death toll because of COVID-19, and we're approaching 2 million cases, it means we're only second to the US in terms of the seriousness of the pandemics in the country. And basically, we're also similar to the US in the sense that we have a president that has been minimizing the seriousness of the pandemic since the beginning. So in March, he was saying, oh, I doubt that more than 800 people are going to die from COVID-19. And now we have over 75,000 people. And he was also saying it's not worse than a regular cold. So it's been very difficult to report about the seriousness of the disease and about all the problems and lack of equipment, lack of personal equipment and everything, because we have very conflicting messages. The central government, the president has been really saying that people should go out and work and that it's not that bad. And at the same time, you have local governors and the media trying to explain all the risks of not doing social distancing and all the risks with the disease, on top of unproven treatments, which you also have in the US, this problem.
And what do you think is the most important thing journalists should be aware of when they're reporting on the pandemic in Brazil? If I were to go out and let's say that I was looking, for example, at the topic of government response, and should I be looking at, for example, where should I go first? Because, the government makes certain official statements. And then in Brazil, as it's like a federated government system, you also have like what the local governors are doing and the local states are doing. Where should I start, really?
Another excellent question. I think maybe other journalists in other countries are also going through this, but at this point, what is happening is that we're really skeptical about government statistics. For you to have an idea, at some point at the end of April, the government stopped publishing the numbers of people who had died of COVID-19 in its social media channels. And in the beginning of June, they just decided to change the statistics method they were using. in a way that it would end up omitting part of the death toll. They only had to stop this because the Supreme Court in Brazil said they could not do this. So what happened is the main media outlets in Brazil, they sort of built a consortium with the local governments and do a parallel statistics, a parallel accounting of cases and deaths, because we can't trust government figures. That's how bad it is. So in other countries, I'm sure there's also some sort of issues relating to government figures. And one of the things that we could do is try to go direct on local or state governments because they're also doing their accounting and it's more direct, right? I mean, there's no middleman in terms of these figures. It's not ideal, but if you have a government that has been trying to, as we say here, do some makeup in the figures, it might be something. And I mean, as a general rule, I would always be a bit skeptical about government statements and information at this point, because pandemic is really a disaster for any government, not only in the humanitarian sense and sanitary sense, but also that the economy is very much affected. So you have a propaganda machine that is working at the same time, trying to spin the messages. So I guess it is a challenge for all of us to try to filter what's spin and what's actual, information and real figures.
Mm-hmm. And you've previously reported on the Ebola epidemic in Africa and the Zika epidemic in Brazil. You have a lot of experience covering a story about a virus and its effect on people. You said that your reporting in Sierra Leone was by far the hardest coverage you've ever done. And before you headed out to Africa, I read you underwent training to help lower the risk of catching Ebola, which I imagine has been helpful in your coverage of COVID-19. What were some of the key things you were taught in that training before you went to Sierra Leone that helped you?
I had the wonderful opportunity to undergo training with Doctors Without Borders people. So they have this really long experience. They have been dealing with Ebola outbreaks since the 70s. So when you're traveling abroad to cover humanitarian or sanitary crises and epidemics, of course you have to go and get all what I did when I went to Sierra Leone. It's different than covering pandemics at home. So when you travel, first thing you should do is try to get all the possible vaccines for all, like cholera or anything that you can get. Because the number one is that you want to try to avoid getting into a hospital in the middle of a pandemic for obvious reasons. So for instance, I usually don't take medicine for malaria prevention, right? Not prevention, I think you understand, right?
Yeah.
Because it has a lot of side effects. But then when I went to Sierra Leone, I went there twice, I had to take this because you don't want to risk getting malaria and then ending up in a hospital because it's the main place where the disease is. So when I went to Sierra Leone, in terms of preparing myself, I did this training with Doctors Without Borders. And basically what we had to do is take our temperatures twice a day, wash your hands. I mean, it's always a matter of not touching your face, washing your hands, and using disinfectants. It doesn't change much, not touching anyone. I remember when I was in Sierra Leone, the doctors there, because even the doctors among themselves, they can't touch ever. So some of them, they were there for 3 months and they felt so lonely and without, human touch, that when they were using the full protection equipment, individual protection equipment, they hugged themselves. They were hugging themselves because they wanted to feel someone, So that's how careful you have to be. You cannot touch anyone. And this is the same now with COVID-19, right? I mean, we have to always keep a distance from people. That's not always possible. Like I've been doing coverage here in Brazil in shelters for people, for homeless people. And there's like lots of people there. And it's very risky environment because you don't know who might be infected, right? So, I mean, to the extent that it is possible, social distancing. And once you go home, what I always do when I'm covering, either if I'm in a hospital or shelter or on the streets, take a shower. Just go to your home, leave your clothes at the door, get them straight to the washing machine, take a shower, wash your hair. It sounds really basic, but that's what the nurses do. That's what we have to do. Um, so I guess Zika was not that bad because it's not in the air, it's mosquitoes, so it's not that bad. I mean, in terms of being contagious. But I guess in terms of sanitary advice or precautions, I would mention those.
So
Not sure
when,
if I answered your question.
yeah, no, definitely. So you mentioned, for example, you go reporting to homeless shelters. So do you, as you're doing that reporting in person, I take it, you're wearing protective gear? Are you actually like, how do you manage to actually conduct the interview with the person in a homeless shelter?
One of the main challenges. I remember when I was in Sierra Leone, I would not wear any of those really protective gear that you look like an astronaut because, I mean, it's almost offensive to people you're interviewing, right? I mean, oh, I'm afraid of you, so I'm wearing all this. So I did not wear anything. I just didn't touch anyone and kept a distance because it's even, it's disrespectful. I felt that, right? But then
Mhm.
again, Ebola was not as contagious as COVID-19. So, I mean, with COVID-19, we don't really have an option. We have to wear, whenever you're going to a place where you might uh, find people who are infected or even asymptomatic, you have to wear. So I did wear both in the hospital. We did a 3-day reporting inside the ICU of a big public hospital here in Sao Paulo, and in the shelter. We have to wear the face shield. I mean, I didn't wear the face shield. I wore glasses, the N95 mask,
Yes.
like an apron, you say that?
Mhm.
Apron and gloves. I mean, the whole, it is weird. And for photographers, it's even more difficult because, I mean, if you're wearing the glasses or the face shield, it's just not very easy to adjust to the lens. And for us, I mean, you have to interview people and you have to, when you interview someone, they are giving part of their precious time to us, to talk to us, and sometimes for about really sensitive stuff or, about their lives. So it's hard to gain trust and not to be invasive when you're wearing full protective gear, right? Uh, but I don't think, I mean, with COVID-19, we don't have an option.
So yeah, so basically between these three sort of viruses that you covered, you did sort of like risk mitigation on like how transmittable is the virus, how dangerous is it, like how much protective gear do I actually need, and what precautions can I take in response when I'm doing reporting on the field. Would you say, I'm kind of curious, like how reporting on Zika and Ebola, because of course, like on these epidemics, you had to approach patients and you had to approach also families, like for example, of people who may have died or victims of the disease. And how has that sort of, what were some of the key things that you learned in, approaching people with these sensitivities? Like how should reporters on the field who may have not reported on on a health crisis before approach patients and approach families? And in terms of just like the general ethics of it.
I remember when I was covering the Zika pandemic in the northeast of Brazil, there was a hospital that several mothers with their newborns or babies who were a few months old and had microcephaly because of Zika. And there were like so many journalists around them. And I saw that scene and I thought, this is horrible. These people, they're going through the worst times of their lives and they still, so I mean, it's always really difficult and sensitive to approach someone who's probably is undergoing the most difficult time of their lives. The one thing I try, and I'm not sure if I'm always successful, and I think we could do is, I mean, if you notice that the person is like a tiny bit uncomfortable, just don't ask. I mean, this is so much more important than getting your interview and getting, quotes. So, I mean, we always have to have this kind of empathy and thinking, okay, so this is a mother who is dealing now with a baby who has a very serious disability in terms of microcephaly, or when we went to the hospital here, COVID-19, we had several family members that were there waiting to see their loved ones, who mostly were intubated in ventilators and couldn't speak. So, I mean, it's really like a matter of being very, very cautious when speaking to these people and family members. In the case of COVID-19, for instance, in the case of Ebola, when the patients were feeling better, we went to a hospital in Kailahu, which was one of the main centers of the pandemics at that time in Sierra Leone. And when the patients were feeling better inside the hospital, you could speak to them because they would go out of their tents and you maintain the distance and you could speak to them. In COVID-19, it's difficult because usually if the person is admitted to hospital, she's really, really in a bad shape, right? I mean, so she's either intubated or sedated, so you don't interact with the patients. You're only talking to the doctors and to the nurses and to the family members. And so the two things we have to pay attention is, one, do not get in the way of the doctors and nurses' work, because they're not there to speak to journalists, they're there to, deal with a disease that they don't even know how to cure. They're still trying. And with family members also, really, really cautious. And if you feel that they are comfortable talking, that this is going to help them, that, in some sense they want to share the story with other people, it's fine. But if you sense any kind of that the person is not comfortable, just back off. That's my approach.
I think very wise words and a very good thing to advise other journalists on. Recently, we had a freelance reporter from Zambia submit a video diary to us, noting that one of the biggest challenges for reporters in her country is that the government is the only source of information on COVID-19 nationally. And she wants to go beyond the government sources to understand how the pandemic is affecting her country. Yet she mentioned that in her country, many people don't want to follow social distancing guidelines, they don't want to wear masks, and some even suggest the pandemic isn't affecting their society. As a veteran reporter, what advice would you give her about where she can get the bigger story about the pandemic, where she is, with those limitations?
Well, thank you for the excellent question. And I think Zambia and Brazil have very similar things in that sense, that it's a challenge to get information beyond government sources. One of the things, usually when you're approaching a pandemic, we try to get different angles. So you're going to try to go to the hospitals, you're going to try to go to, I'm not sure how to say that in English, for older people when you
nursing homes, the nursing homes.
Nursing homes, the places that are most affected. Also try to see people who are dealing with the disease, people who work in cemeteries. What's their life like today? Or if you have public hospitals and you're trying to go beyond what the government is saying, or the Ministry of Health, you might try the doctors' union, because the doctors' union, they're discussing the trouble they're facing doing their work, if they don't have enough gloves, or if something is not being done correctly. And the nurses' union, this is also an approach. Or other things that are not directly related to the disease, but you could go to a poor community and see how are people dealing with online classes. I mean, how do you do if you have a poor internet connection? How do you have online classes with your kids, right? Or how do you do social distancing in a poor community where 5-10 people live in 2 rooms? I mean, I think it's always trying to, and this, you don't depend on the government to do that. You just go out there and do. Sometimes to go into the hospitals, you need authorization. And you can try this, but on the other hand, you can try to speak to doctors' unions and nurses' unions just to say, what is it inside? I mean, outside of the whole government speech or what they're trying to convey, what's really happening, what's really, the people who are working there, what are they really facing? Not sure.
I think that's a That's actually very good advice, to go to different aspects and not just solely the government. And I even like the idea of going to cemeteries, because those are people who are actually seeing a rise potentially in the mortality rates and the people they're burying, and it's another place to get information. Now, we're going to jump to a topic you're a bit more familiar with. Like many countries, Brazil has also faced the spread of disinformation and misinformation regarding COVID-19 on YouTube and on other social media channels. Recently, Facebook removed dozens of what it said are fake social media accounts linked to the offices of Brazilian President Jair Bolsonaro and his sons. The accounts were used to target journalists and political opponents of the president, and they also discussed the coronavirus. The accounts were said to amplify Bolsonaro's claims that the risks of the coronavirus pandemic are exaggerated. Could you tell us a little bit about that case?
Yes. Well, Brazil, as the US, I think, is drowning in disinformation about COVID-19. To have an idea, the YouTube channels that are showing COVID-19 related information, the most viewed ones are the ones who are spreading misinformation or disinformation. For example, chloroquine should be used from the day one that is suspected infected, or chloroquine, is a cure. Or now there's this other thing that is medication against worms that they're using, ivermectin. This is also being, peddled in all those channels. And people in Brazil, Brazil is the second country with the largest number of WhatsApp users, second only to India, right? So pretty much it's very pervasive. People get their information from WhatsApp, and WhatsApp is encrypted, so you don't have an idea of what's going on, right? So most of this information spreads through WhatsApp, and we don't have control of what people are believing in or not. When you have a president who is not only not doing anything against disinformation, but contributing to it and being a source of it, because our president was the one who got videos. One of his videos was taken down by, I think it was an Instagram, because he was like there, shaking hands with people and saying, you guys should go out, there's no problem, there's no need for social distancing. So it is very hard to deal. Because at the same time you have the newspapers and doctors trying to convey factual information, science-based evidence. And on the other hand, you had this big machine, this information machine, fueled by the president and some of his allies, and going on through WhatsApp and all social media uncontrolled. The Facebook accounts that were taken down by Facebook, one of the things that they were spreading was, unproven treatments and all those kinds of things. The one thing I think it's changed is that COVID-19 made the internet platforms understand that when it's about a disease that can kill, there's no, hands-off approach to moderating content. It's the first time that they are actively labeling content as disinformation or unproven, with Bolsonaro, with other people, I think with President Trump, I'm not sure if it was COVID-19 related, but I mean, they started labeling content as potentially harmful content, right? That is going against their rules. It's not moderating content, which is a very complicated thing, but it is labeling when it goes against their rules, their terms of use, especially when it can mean life or death. I mean, we've seen everywhere. In Iran, I think there was some sort of hoax or disinformation spread that led people to using a toxic medication, or I think it was alcohol, that led people to die. In Brazil, the two most common pieces of fake news that were circulating, one of them was saying that actually the coffins were being buried empty with stones inside, because people were pretending the pandemic was serious, but it was not. So the governors were just promoting burials with empty coffins. And this was spread by, government allies. And this was everywhere on WhatsApp and Facebook and everywhere, right? And the other thing is that the hospitals were actually empty. That, this was all a lie. COVID-19 was not really serious, and the governors just built this hospital. Now there was no one in there. This was also something, piece of disinformation that also President Bolsonaro was spreading. So it is very hard to deal with this environment.
I mean, that's incredible. And I have to ask you, when you have a government, for example, challenging media reports or even politicizing media in such a way, and even claiming that what media is putting out there is false, like what, as a journalist, can you do ultimately to win back public trust? Because they're sowing so much doubt that even what legitimate journalists put out there is fake, right?
There is a systematic effort to delegitimize traditional media, professional media. It got to a point that the main media outlets in Brazil stopped sending their reporters to the presidential press briefings because they were being attacked by the president and by his supporters, who were always, either yelling fake news media or communist or something along those lines. But I mean, it is a challenge because whenever we give negative news or, figures, there's always this attempt to say, this is the media who actually doesn't like the president, who's, communist or whatever. So we can't believe. And a part of the population does believe this spin. Basically because, yes, social media and they're getting their info. It's very hard. People say, digital media education. You need to check whenever you get some piece of news or piece of information. But this is not so easy. I mean, I don't see many people in Brazil, they use WhatsApp and Facebook for everything. I don't think they're going to get a video saying, you should take chloroquine from day 1 and the warm medication from day 2. They're going to actually go to Google and check. So, I mean, we're all trying, and in the whole world, how to deal with this, right? Because at the same time, newspapers online or online websites, news websites, they don't have the same reach as this information going through social media.
And interestingly, for quite a while, President Bolsonaro was denying that COVID-19 was a problem, and recently he tested positive for the virus. Has that changed anything about the way he and his government is handling the pandemic?
I don't think it has led to policy changes because they're still, the president is saying, I took chloroquine and I'm fine. So they're still doing the whole chloroquine thing. One thing that happened is that because President Bolsonaro is in isolation, he's been more quiet, which has been a relief because there's no, political crisis or, attacks against the media or opposition. So this is the one thing that changed. He's in isolation. He's not been talking that much or, giving public statements. But I don't think it's going to change. No, it hasn't been like Prime Minister Boris Johnson in the UK, right? In which he was sick and he thanked the nurses and the national health system and everything. No, we haven't had this moment in Brazil yet. No moment like, oh yeah, actually it is very serious and I feel for. Up until now, we've had very few statements of, solidarity to the family members of the people who died of COVID-19. The president has not really expressed his sorrow. And I don't think the fact that he caught COVID-19 is going to lead to any policy changes.
I guess the truth is not worth much for some people.
Yeah.
That's very unfortunate. Are there some stories or even angles to stories regarding this pandemic you believe need more attention and more coverage, whether in Brazil or anywhere in the world? what do you think journalists need to be covering more of in regards to this pandemic, or even amplifying?
I usually think that stories dealing with the poorer population are often, underestimated or not enough reported on. So I think one of the stories is the stories I think of uh, favelas or slums or poor communities. How do you do social isolation when you live a lot of people together? How do you avoid or people, do home office? How can you do home office if you're an informal salesperson or if you're a delivery person? You don't do home office. So how poor communities are dealing with this, I think we should focus more on this. Also the schooling part, you know thousands, millions of children, they're gonna just miss their school year because some of them, there's no good internet connection. So maybe we should be talking to the parents and to these kids. How is your life? How are you doing the whole online thing in very precarious situation? And the other thing, to be on the bright side, maybe more stories about what's going to change in the world after the pandemic, or when we gradually get out of the pandemic. How is that going to have lead to a permanent change in the sense that how we work, offices, how are offices, even the furniture, or do people go there or not? Transportation, are people going to avoid public transportation? I mean, there's so many things that we should be looking at, as to what is going to change forever in our lives after this pandemic.
Thank you for that. And we have, I think it's about 10:33 right now, so I'm going to open it up to audience questions. So if you're on Zoom, please do your add questions to the chat. And I already see that we got quite a few. So this question comes from Bruna Camargo, and she asks, Patricia, would you please tell us how you decided to write a book about the fake news issue in Brazil? And how did you sort of set it up? What was the process?
Thank you, Bruna, for your question. I started covering indirectly disinformation campaigns in 2014, actually covering the use that populist leaders make of disinformation campaigns and social media. So it started with the Indian general elections in 2014. Prime Minister at the time, he was a candidate, Narendra Modi, he was a very keen user of Twitter, and all this attempt of bypassing the filter of traditional media to reach supporters and voters without fact checking, without just eliminating any inconvenient questions and just reaching out or reaching your supporters directly. So I started covering this in the context of the Indian elections in 2014. Then I went to the US and I covered the 2016 elections, President Trump, which also had a very strong component of disinformation campaigns on Facebook, Twitter, etc. Then 2018 in Brazil. So the idea of the book was to try to understand how this new generation of leaders, mostly populist leaders, are using these technological tools to mold the narrative and to make people, believe. There's always been propaganda. Government has always done this, but I guess social media represents, it gets more efficient, right? So this is how I decided. And now with COVID-19, the whole issue of disinformation got, so much more important, because now, this lie can mean deaths. And at the same time, I do think I have this hope that there's it's some people who are actually reevaluating or giving more credit to professional media, to professional journalists at this time. They're actually saying, okay, there is value to someone who's there out asking questions and checking figures and, and looking for facts. After so many years that the media was suffering from some sort of, delegitimation, discrediting, now there's some reevaluation of it.
Great. And this question comes from Alexandra Orico, who's actually our community manager for the Portuguese Language Health Crisis Forum. He says, you suffered attacks from troll armies on the internet, especially at election time. Did that change anything in your coverage of COVID-19? Did you, for example, take steps to protect yourself in different ways, or were more careful in taking interviews from sources?
Thank you, Alexandra Rico, as a colleague. I think we're all adapting to covering governments that see us as enemy of the people. So we're all extra careful when reaching out to official sources, also really careful about our security online, about being hacked. I've been hacked before. So I guess it's sad that we have to do this, but we have to be so careful when we are trying to, get information from the government, or when we are using our social media accounts, because it is a hostile environment for journalists. It just became that we're seen as enemies. So yeah, I am more careful.
And jumping off of that question, I actually have a question here from Ali in Iran, and he says, the problem we have in Iran is that people are tired of coronavirus news. How can we keep covering this story and still keep people's attention and maintain their sensitivity to this health issue?
I totally sympathize with our Iranian friend. I feel that people are just, it just become normal. Oh, another story about people dying in a hospital, another story. It's very sad that these things, people are just fed up with the news, and it's no longer, people are not getting shocked at this kind of news. But we have to keep on reporting. We cannot normalize this, right? I mean, no, okay, so now this is the new normal. We have 1,000 people dying of COVID-19 every day, and people are not paying attention because, well, we've already written about everything, which is what's happening now. I think I am still trying to find a solution to this problem. I have pretty much the same problem, new angles, new approaches, so that people keep paying attention on this news, and do not grow used, think, oh, okay, 1,000 deaths, that's fine. I'm not sure what to do. Actually, I have to confess, I'm also looking for this answer.
I think, this is a problem we're all having everywhere. I mentioned once to my colleagues that very similar to war reporting, when a war first starts, everyone is like reading news about that war, but after a certain time, it's almost like they're fatigued by all the negative news.
Exactly.
And speaking of which, you've also covered war, and you've covered the refugee crisis. And Bruna also asks, what do you consider harder, covering a war or covering a pandemic?
Well, of course, both are difficult. I think this COVID-19 thing, it's been very difficult because even though I am home, I am covering home, we feel more, it seems more dangerous. I don't know. Just because we're home and there's something, we usually have this thing that, okay, I go to a country to cover a war, and it's very unfair because I leave my home where I have a warm bed, or I have a room with air conditioning, and I go to a place where people are fighting in a war and suffering, and then I come back to my place, right? I always feel guilty about this. And then when you're covering pandemic in your home, right? That you're not safe in your home. It's a different feeling. It's very different. But in terms of comparing a war with a pandemic, I think in both cases, I don't think it's more difficult one or the other. I think it's the same. Maybe the enemy, in the case of a pandemic, the virus, it's more, it's less visible, right? I mean, you don't know where it's coming from. but both we have to be really cautious in terms of approaching people and asking people, because in both cases we come from a privileged situation of being sort of outside danger, right? And yeah.
And very interesting that you also mentioned the fact that many reporters are limited to working from home, and some will still take the risk to talk to sources outside of their home, like you mentioned. So one question from Mariana, she asks, how do you find story ideas? Is there anything in particular you actively pay attention to?
It is, thank you, Mariana, for your question. It is really hard because I think that's the essence of being a reporter, right? Like you go out and you meet people and you get information. So doing it from home, I am usually working from home, doing everything from home, except when I'm doing COVID-19 stories that I go, shelters, hospitals, or poor communities. There's two topics that I follow actively. One is foreign policy, which is what I usually cover, before the whole disinformation explosion, and disinformation. I think I have been following both. And I agree with Mariana, it's very hard to get story ideas when you're stuck in your house, in your home, right? How do you see what's happening outside? I would say, go outside and speak to people, but that's risky, right? You can't, social media could be helpful in that sense because of sort of, you get some thermometer of what's happening, and some developments that you were not really paying attention. It's not perfect. It's an imperfect way of getting the temperature of reality, right? But I guess that's going to be like this for a while.
And Bruna is a great fan of your work, by the way. She has quite a good number of questions. She asked, Patricia, you're an inspiration for journalists in Brazil. What's the name of someone in journalism you are inspired by?
Oh, so many people. There is a Brazilian journalist, Dorrit Harazin. I think she's wonderful. Maybe you've heard of her. She covered wars, and she's been working, and she writes beautifully. Miriam Leitão, who's an economic commentator. I'm actually a big fan of these strong women, and they actually lived through military dictatorship. They faced all the difficulties. I mean, what we're facing now, it's difficult, but it's nothing compared to what they lived during military dictatorship. So I would definitely mention Miriam Leitão and Dorrit Harazin, who are both Brazilian, and Maria Ressa. Maria Ressa is this wonderful person. I had the privilege, the Filipino journalist, I had the opportunity to meet her 2 years ago, and she's just wonderful. I mean, her work, and she's so, self-deprecating. She's not, I mean, even though everything she's been going through and the persecution, she's just great.
And here's one question from Kunal. He asks, do you have any fact-checking tools that you think kind of help improve our credibility as journalists? Are there particular tools that you use, Patricia, in the course of your work to check information?
Fact-checking tools?
Yes.
There, in Brazil, and I mean in the world, there are several fact-checking agencies, right? But I always, whenever possible, and that depends on the country, it would be advisable to go to the original database or original source of information. This is something I always try to do, when you have, but sometimes what happens in some countries is that this is not so easy to access, or the government is making it more difficult. For instance, here in Brazil, we have our kind of freedom of information, Freedom of Information Act, right? So we can get, it's Lei de Acesso à Informação. It's a legislation to access information that we can request to get original information from government. This is very important. I'm not sure if other countries have that. I'm sure a lot of them have. This is also good because you get direct information from the source. This is always a good strategy, I think.
Great. And a question from Ana Rebelo. Despite all the fake news we're seeing, an increase in the value of professional journalism in Brazil, do you believe that this is a positive consequence that will endure after the pandemic? And do you think that the fight against fake news will last for a long time?
Thank you, Anna, for your question. I do think, yes, there is people who are just looking at journalism with a different perspective, you know, after a lot of criticism that journalists were getting, and some of it justified, you know, for mistakes, people started to see value in professionals at least trying to get both sides, you know, question statements and fact check. Um, I'm not sure. I mean, the pandemic is so horrible. It's such a horrible tragedy that I'm even scared of saying that there's anything positive coming out of it. But I mean, it is a consequence, that new approach to journalism. I think the situation. I'm sorry. The second question was if the situation. The disinformation. Yes, disinformation. It's really. We don't know how to deal with this. We know that just a piece of legislation is not going to solve it. It could end up making it worse. We've seen in a few countries that it tends to criminalize just regular social media users. At the same time, we know that it is unsustainable. The situation, at least in Brazil, some other countries, you know, there's no accountability whatsoever. You have it's not just like a regular person who's sharing some fake news. It's criminal organizations that are spreading fake news and defamation campaigns. And I think in that sense, there is a realization among both legislators and NGOs that there has to be something done against the professional part of this disinformation campaigns, right? Like the people who are financing, the people who are doing this in a professional way. But there needs to be so much caution as to not to end up criminalizing speech or just violating privacy rights or freedom of speech. I think at this point, at least, there's a realization that this is a problem and something has to be done. And now we just need to find the middle ground, you know, not to end up with a legislation that it's even worse than what we have now, which is no legislation.
We're getting a few questions from reporters, like, for example, from the Philippines about, like, for example, why are media companies now being like the most targeted things by governments in different parts of the world? Why they're more targeted now compared to in the past. And another question from Diana Ramos in Venezuela. She asks, like, how can a journalist be trusted by their community and citizens when the government isn't giving them support? So what are some tactics you take despite all these attacks you get from the government, despite lack of support from the government, or even a government directly targeting you as a journalist? How do you maintain the trust of your readers? And how do you maintain your credibility?
Thank you, Diana, for your question. I think Venezuela is living and has been living something that is worse than Brazil, but in a sense, it is similar. My Venezuelan friends say that Chavez started with this demonization of the media, right? I mean, this thing of saying, you know, the media is the enemy, and it, of course, continued with Nicolás Maduro. And this is the path that Bolsonaro is taking in Brazil as well. I think one of the things we could do to try to keep our readers, keep some trust, is be transparent as much as possible. You know, first of all, say who you are. Oh, I am this person. I am a journalist since I don't know when. I work this. How do you get a story? What do you know, oh, so you go out, because people don't necessarily know how journalism works. They think you might be a blogger just sitting on your room and just inventing stuff, you know, making up stuff and writing. So maybe if we explain how it works, you know, so we go to sources, we get, you know, different views, and then we fact check. I think maybe that could be a way of some people to regain trust in what we do, right? It's the same thing. I usually, when you go to a restaurant, in a way, some restaurants in Brazil, they had something that is called Visit My Kitchen. you want to know how the food is done. So they wanted to be transparent to see, okay, so this is all clean, this is the, so it's visit our kitchen journalism style, like people just explain what you do, explain who you are, explain how you got to some stories, how you got your evidence. Of course, sometimes you have off the record sources or background sources, and then you also explain what that is, and why these people want to remain anonymous. So this was the second question, right? The first question is why media outlets are being targeted. In several countries, I think it's not only media outlets. I think it's every institution that acts as checks and balances to governments. We have several populist governments with with an authoritarian bent, right? So whatever acts as some sort of, obstacle for them, be it independent media or activists, human rights activists, or the judiciary, it's going to be targeted, because the goal is to discredit the enemy, right? So in that sense, media, whenever it does not bow towards the pressures of the government, it's viewed as an enemy. And now internet comes into play because at the same time that there was a democratization of the use of sources of information, which is really nice and healthy, you can just, in the sense that you want to confront or attack traditional media, you just use social media as an alternative channel and also to discredit it. So I think it's easier to attack media nowadays. That's why maybe it's more widespread. But I think it's part of a scenario of attacking all institutions that act as checks and balances, because we have this generation of populist leaders with an authoritarian bent.
Absolutely. And I'm going to ask sort of this final question to help wrap up our discussion, because you have such an astounding amount of experience. What is your biggest lesson learned reporting on the pandemic in Brazil that you would give other reporters around the world covering this pandemic? The most important one, you think?
Whenever whatever coverage I'm doing, it's always empathy. It just teaches me once again that, a story is just a story. Just don't invade anyone's space or make anyone uncomfortable. And in the sense that we also have to look in the terms of empathy. These people, they have a life outside the pandemic, just the same way that people have a life. They still go on with their lives, even though there's a war going on. They still go on with their lives, even though there's a pandemic going on. So whenever I'm doing reporting, what I try to do is put myself in the shoes of the person I'm speaking to or I'm reporting to. I think this is a lesson that I learn over and over again every time I do coverage. And when we're covering something so sad and so horrible as a pandemic, that's even more valuable. Before you're writing something, think, okay, so these are people, right? So think about their families, what they're going through. I think this is the lesson.
The most important thing. I think that's the best place to wrap this up. Thank you so much, Patricia, for joining us today and helping other reporters on this very significant topic. It was great having you here. And to the reporters who are watching, please keep the conversation going on our Facebook forum group. And if you don't have Facebook, we encourage you to sign up to our forum newsletter, which you can find on www.icfj.org. And just to let you know, in terms of upcoming events, next week, we're bringing back Dr. Claire Stanley from Georgetown University to give us her expert view on how the public health responses to COVID-19 have evolved 6 months into the pandemic. So we hope to catch you next week. Patricia, thank you again, and congratulations on the award. We're so happy for you.
Thank you. Thank you for having me. It's an honor to be able to participate. Thank you.
Brilliant. Muito obrigado. Tchau.
Obrigada, tchau.